The coronavirus disease 2019, COVID-19, is caused by the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. Here's a brief overview of its origin and spread. The earliest known cases of COVID-19 were identified in December 2019 in the city of Wuhan, Hubei province, China. The exact source of the virus is believed to be a seafood market in Wuhan that also sold live wild animals. It's thought that the virus originated in bats and might have been transmitted to humans through an intermediate animal host, possibly a pangolin. The World Health Organization, WHO, sent experts to investigate the origins of the virus, but a definitive source was not confirmed. Spread. After its initial emergence, the virus quickly spread within Wuhan and then to other parts of China. As the virus was highly transmissible, it gained international attention and spread to multiple countries. Key factors contributing to the global spread included international travel and the interconnectedness of the modern world. By early 2020, COVID-19 had become a pandemic, as declared by the WHO. It spread to virtually every country, leading to widespread illness, disruptions, and health and economic challenges. The virus primarily spreads through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. It can also be contracted by touching surfaces or objects that have the virus on them and then touching the face, especially the mouth, nose, or eyes. Governments and health organizations around the world implemented various measures to slow down the spread of the virus, including lockdowns, travel restrictions, quarantines, and recommendations for wearing masks and practicing physical distancing. Efforts to control the spread of the virus also included widespread testing, contact tracing, and vaccination campaigns. Several vaccines were developed and authorized for emergency use to prevent COVID-19, offering hope for reducing the impact of the pandemic. It's important to stay informed through reliable sources such as the World Health Organization, Centers for Disease Control and Prevention, and official health department websites to understand the latest developments regarding the origin, spread, and management of COVID-19. Key characteristics of the coronavirus and the associated disease include transmission. The virus primarily spreads through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. Symptoms. COVID-19 symptoms vary widely and can range from mild to severe. Common symptoms include fever, cough, shortness of breath, fatigue, muscle or body aches, loss of taste or smell, sore throat, and more severe symptoms such as difficulty breathing. Incubation period. The incubation period for COVID-19, the time between exposure to the virus and the onset of symptoms, is typically around 2 to 14 days, with an average of about 5 to 6 days. Severity. While many individuals experience mild or moderate symptoms, some individuals, particularly older adults and those with underlying health conditions, can develop severe illness, including pneumonia, acute respiratory distress syndrome, ARDS, and even death. Prevention. Preventive measures include wearing masks, practicing physical distancing, frequent hand washing, avoiding large gatherings, and following public health guidelines and recommendations. Vaccines. Several vaccines have been developed and authorized for emergency use to prevent COVID-19. Vaccination efforts have been underway globally to control the spread of the virus and reduce its impact on public health. Global impact. COVID-19 has had a profound impact on public health, economies, and daily life around the world. It has led to travel restrictions, lockdowns, remote work, and significant changes in how societies function. Mutation variants. Like many viruses, SARS-CoV-2 can mutate over time. Some variants of the virus have raised concerns due to their potential impact on transmissibility, severity, and vaccine effectiveness. The most common symptoms of long COVID are extreme tiredness, fatigue, feeling short of breath, loss of smell, muscle aches. However, there are lots of symptoms you can have after a COVID-19 infection, including problems with your memory and concentration, brain fog, chest pain or tightness, difficulty sleeping, insomnia, heart palpitations, dizziness, joint pain, depression and anxiety, feeling sick, diarrhea, stomach aches, loss of appetite, a high temperature, cough, headaches, sore throat, changes to sense of smell or taste, rashes. Thanks for watching. Please subscribe Basics and like and share my video with friends and family.